A very good evening to you. Thank you for keeping it tuned into UBC TV. My name is Sophia Matovu and you're watching U Health Chat, proudly sponsored by National Medical Stores. Now, we're going to talk about a stroke. A stroke is the leading cause of lots of deaths and even actually lifelong disabilities for some people. But given the fact that I'm not the expert, here with me in studio to talk about the topic of how to deal with an emergency or emergency response for a stroke is none other than Nabale Titus Carlton, who is a young physical therapist, but he's very passionate about the topic and he was very willing to come to studios to talk about it. Good evening, Titus.
Good evening, Madam Sophie.
Okay. Titus, there are certain times we normally would like to go through the normal routine and normal way. When we talk about a stroke, what is a stroke?
Okay, stroke. Okay, really, I want to say thank you for this opportunity to be here. And then, yeah, if we start with stroke. Stroke is injury to the brain. Like it comes mainly from like the blood flow to the brain is interrupted with, like usually comes from sometimes, most cases, comes from the occlusion, could be blood clot, could be like the blood vessels going that being like interrupted, like parts like breaking. So it is mainly an interruption in the blood supply to the brain. Basically, that's a stroke.
Okay. Yes. Now, I'm made to understand this is becoming a normal, not normal, a frequent occurrence now, yes, where people at your level are dealing with lots of the people with this. What is the cause of a stroke?
So stroke has a number of causes. For the stroke, really, like right now it's rampant because like people, like life has really changed. People are so sedentary, their lifestyle has really changed. So the causes mainly come from someone like the first and more very important aspect is high blood pressure. High blood pressure is really like something that's so common nowadays. People are so stressed, depressed. They have so many things to run. So in the way that people, they tend to have this problem. And so like stroke, high blood pressure could be from trauma. There are so many causes, but we have many what called predisposing factors to this problem, which is age, could be genetics, someone the way you're made, could be like hereditary, like how you were brought up. Like if your family, one of the people had stroke, there's more likeliness of you having the stroke also. But mainly it's more of a heart, could be mainly that blood vessel like related saturated problem is the cause of the stroke problem. Yeah.
Okay. Then I made to understand you have what you call a pre-stroke.
Yes.
Please kindly elaborate and help me, educate me about it.
So a pre-stroke is something that happens not something, it's a real occurrence, but happens in a way that to warn you that there's something coming up, more so of a stroke. So some people, they call it a mini stroke or TIA, which means transient ischemic attack. So it happens in a way that it lasts for less than 24 hours. That's what we call a pre-stroke or mini stroke. So it's something to warn you, and it's a call, it's a sign telling you that there's something that could happen or like it's coming. Yeah. So that's a stroke.
Now, in terms of a person who's watching you right now,
yes,
given that you know certain times some people will get the major stroke day one or right from the start, while others might get the warning signs. Can you share with us the signs and the symptoms? How does one know and is able to identify that when I feel this, then I know that possibly chances are very high I'm going to get a stroke?
So like it comes from, there's a small, call it abbreviation or synonym, whereby someone says it's called FAST. So like even if like you see someone and they have one of you see their face is sloppy, one side mainly, and they can't raise both arms at the same level, or like you feel them like having sudden weakness like in the one side mainly. And some people, they come with an intense headache, so intense that it's so painful. Some people even pass out because of that intense headache. One of the signs. And then is someone passing out, lightheadedness. Yeah, that's one of the signs that you can get for a stroke that's happening. And then also numbness one side. Yeah, basically that.
Why does it basically strike? Because most times you'll find the effect is normally on one side. It's not like the whole body. Why does it turn out that way medically?
So if you look at the brain, the way it is made, it is having the left and the right hemisphere. So the left side controls the right side. The right side controls the left side. So if you look at the blood supply and the causes of the stroke, if you look, there are about mainly two types of stroke. We have the ischemic and the hemorrhagic. So, and then some people, they include the other mini stroke, the pre-stroke talk about first. Some people include it to be another type, but basically there are two types, the ischemic and the hemorrhagic. So if you look at the ischemic, which makes up about 80 to 85% of the cases of stroke. Yeah, so for it happens in a way that, like, an occlusion happens. Let me say, like some substance, like could be fat, could be but mainly fat, and a blood clot. So it travels from one place to another. So like as it's traveling, it goes up to one of the blood vessels that goes to the brain, and then in a way that it occludes and blocks the blood flow to the brain. So the brain cells are so sensitive in a way that they begin to die off in a matter of minutes. So most cases the occlusion happens on one side. There's no like evidence that suggests this is the reason why, you know. Yeah, like but basically, like when the clot is traveling, goes and occludes one, like certain part of the brain, which goes to mainly, it could be one side basically, and then that's where you find someone having like the other side affected, because it goes to the right side, it's going to affect the left side, the right side of the hemisphere, right hemisphere, it affects the left side, and then if it goes to the left side, it affects the right side. So that's the reason why, but there's no basic reason that this is it. Why it happens, well, like it strikes only one side. Yes.
So how does it normally strike? Does it come with a kind of form of a seizure? Will somebody just collapse? What exactly happens?
So after getting that, after happening like this, immediately you feel that intense headache. You see someone collapsing. So it just happens. Someone collapses, or like from nowhere. It happens like someone may collapse, or someone like becomes just like they are doing nothing. They don't even understand what's happening. It's sudden confusion, and just they are doing nothing. So like it's not fixed that it should be happening like this way. Like it happens, like it differs in different people. So that's basically it.
Okay. Now in terms of like the person is brought, because this is an emergency, it's a serious medical emergency, what should be the first aid? How should they go about it in case you identify that a person has gotten a stroke?
So like after seeing someone and you suspect a stroke, you do what you call a first. The first is you look at the face. If it is slope, you ask them to smile or do something with their face and see if they're responsive to that. You note that. And then you go to A. Ask them to raise both arms up. If like it's a stroke, you see them struggling to raise one arm, like one arm goes up and the other one stays down. And then speech. Ask them to say something. What do they remember? Ask them to tell them, ask them about their name. What is your name? See what's their response. And then T, it is the time. Use that time to call emergency. See? So like stroke is a medical emergency. There's nothing you can do like first aid, do this or CPR. No, it's what you need to do is first get those three signs, and then after confirming them and say stroke, you just have to call emergency immediately. So as the emergency is arriving, like the emergency team and all that, you have to reassure them, put them in a position whereby they are able to breathe. Because some people, after getting the stroke, they can fall down and hit their head or something, and then the airway could be blocked. So all you need to do is put them in a position whereby they can breathe, they are not in any danger, yeah, that's what you need to do. But there's no basis to say that you need to do this and that. It's a medical emergency.
Oh, wow.
Yeah.
Then after you have diagnosed that, when they get to the hospital, what happens? Because given the fact that it's a medical emergency, is it a scenario that basing on the assessment they might be taken straight into serious emergency like intensive care, or how is it managed at the level when they bring this patient to the hospital?
Yeah, so the management, it calls for surgery, immediately surgery. So they have a technique whereby they can give you if like depending on the type of stroke, if it is hemorrhagic or like ischemic, but they have to do the scans first. CT scan, MRI, to find out the problem, the type of stroke you have. So if it is ischemic, sample they can be administered with blood thinners. So those blood thinners help to dissolve some of those clots, prevent them from further further blocking other areas of the brain. Yeah, cool. And then another thing is some surgeries help to actually surgery. Nowadays technology is really advanced, so they use some of the techniques and then they go in and they bring out the clot. Yeah, so and then another mainly surgery, and then people can go into intensive care unit depending on how the level of damage. Stroke is very, very dangerous. It's one of the leading causes of death. Actually, the World Health Organization states it as the second leading cause of death, and then fourth, like the leading cause of disability. It is very, very serious. So the response is really surgery, or so surgery, bed rest, intensive care unit, depending on the level of damage. Yes.
Now, certain times, many of them have gotten to a point, like say somebody has been on blood thinners, and assuming the vein or the artery is unblocked, are there chances that somebody will recover and get back to normal?
Yes, the chances of recovery are there, though the recovery is not always the same, since people are different. The way someone recovers from stroke, though they have the same type of stroke, it is always different from the other one. Yeah, so like the recovery is very possible. It is very possible. Yeah, it happens. People have seen people recover from stroke. Actually, it's not really right calling them saying that they have stroke. Stroke is that incident whereby someone has gotten the attack. The sudden attack. So after that, they're called stroke survivors. Okay. So stroke survivors, like the recovery, it is always in terms of people recover in a way that they start picking up slowly. What's something called neuroplasticity. So the brain starts rewiring itself. Okay. Yes. So like rewiring itself in a way that like the functions of the cells that are dead are taken up by other cells, which are of the brain, of course. But only that thing is that the brain cells, once they die, they don't recover. So after them dying, it's mandatory for the brain to have the other remaining cells take up the functions of the dead cells. Yes. But the problem is that it takes time. We can't tell like what time it will take. It takes time, and yes, eventually some people pick up, other people don't, and then it's something really broad.
Then at what stage, because there are certain times it's become a routine where everybody knows that if your patient has undergone paralysis, then they have to undergo physiotherapy. It is one of those major recommended areas. That's where you come into the picture. At what is it, because they have seen and observed that the paralysis is something that can be fixed, or what exactly?
Okay, so the brain is really complex. Even to this age, little is known about it. Sample actually 20% of it is like it's like the known bit of the brain is very, very little. Even the way it recovers, so like extensive research is needed in this field. But for the moment, like the physiotherapy is a requirement because it ignites that rewiring process. That's like the one that I talked about, the neuroplasticity. So like every time it has the stage at which it should be started should be as early as when someone is admitted to the hospital. Yeah, so like the thing comes in that someone, after anyone, when they're in a state of posture and they're not doing anything like movement, there is tendency of their tissues coming together. Stiffness kicks in the joints. The muscles start becoming thin, which you call atrophy. So in a way that physiotherapy helps prevent that, and it facilitates recovery in like at a faster rate. So as early as someone is admitted to the hospital, you need to do physiotherapy. Physiotherapy has a range of techniques that we can use. Yeah, some people, they are not confident with physiotherapy. They think it's all about exercises. Like exercises is a big topic. There are exercises I can do with someone who can do anything, and exercises I can do with someone who is literally normal. So the stage comes away from where the person has a problem till recovery. Yes.
Okay. Because when you talked about the techniques, assuming somebody has, I guess the stroke, does it have to be a particular entire side, or it could even limit and say hit only the arm, for example? Because how do you deal with it? How do you awaken those nerves to ensure that the arm is able to have mobility again?
Okay, so yeah, so like it's like the commonest ones, the one we know is it hitting one side.
The whole one
Yes,
side.
one side. That's the commonest. But sometimes you find someone affected being like having one side, like be one limb which is affected. See, like the brain is like a map of the whole body. So, but it's very rare, like for it to have only one arm affected. No, it's very rare. Because like if you look at the brain, there are sections which are really like one section is like controlling the whole one, like controlling the limbs. See that? So like for it to be specific, it is really hard. Actually, it's very rare. And then if someone, let's say, is affected by, it's the arm that is affected, what we do is early stages we can do what we call passive exercises. Those ones help us to maintain the joint range such that the joint is able to move still, because every time the joints are left are left immobile for a long time, they start thickening. Like that like synovial fluid becomes more like, it's supposed to be oily, but someone who's not moving their joints, it thickens and becomes very thick. So someone's joints are stiff. So like passive exercises, they hope to maintain that range and the mobility. So we also do what we call stimulation. So like the nerves, like of that supply that side of the arm, or could be the limb, the lower limb. So it stimulates the nerves. So the nerves, they control the movement of the limbs, all that. So like the stimulation still keeps the joint, like the muscles active and the nerves active. So like in that way, the body regenerates itself. Like it's a slow process, but it takes time. Like people pick up as time goes on, but it's a range of things. But it's a stage, move from one area to another. We start with basically passive, then we can go to actives. We can also use machines, like at the one I told you, the stimulation. So there are machines like TENS, there are transcutaneous electrical nerve stimulation. It helps to work in those nerves, and yeah, basically someone picks up as time goes on.
How do you manage and deal with some of the clients or patients that you get to interface with? Because you know, the brain, like I would say, response would also be natural. Now, if somebody's speech has not been affected, and say, yes, it's the paralysis on one side, and they want instant and quick results as they keep coming in maybe for regular physiotherapy, how do you manage to deal with that?
So, like the recovery process is teamwork. So, personally, when I'm dealing with a patient, I tell them first that you are the driver of this recovery. So we need to work hand in hand. And then another thing I tell them is that it takes time. The brain takes time. I can't promise you it will be this time or that time. No, I can't say that because I'll be lying to you. So it's really hard. I can't say it is easy. Some people, they want instant results, which is really out of this world. And some people get them actually, depending on the type of stroke. Some strokes like could have mild injury like to the brain, so that's why some people they can get the results quickly. And so like if someone like a patient who has gotten a stroke and sees someone who had the stroke and they tell you like I recovered in this time period, and then like that brings in that problem whereby patient wants the same results. So I explain to them, I tell them really, our bodies are different. Don't expect him to recover the way, like don't expect yourself to recover the way that he recovered. So education is really important, telling them about their condition and working together as a team. Like we work together with neurologists, we work together with other people like occupational therapists, speech therapists. Some people lose their speech in stroke. So like we manage them in a way like it's a multidisciplinary team. And then yeah, so it is a hard one, but really we keep on.
What's the longest period of time, say in your years of working in this field, have you had to treat a patient with a kind of condition?
Actually, I have a client right now, today, tomorrow. She's been attending to her for over 2 years. That's how long it takes. It takes time.
For a stroke?
Yes, and we are still moving. Thankfully, she accepted her condition. I don't know if she's watching right now, and I really want to thank her and appreciate her. She's been really patient, and I know you'll get there. So it's been over 2 years, and we started off with difficulty in moving. She was using clutch. Right now, she can move. Yes, but with difficulty still, but she can move by herself.
Without a clutch?
Yes. And then you can see like the strength is in the strength is there. She got back to work. That's something really, really important, because as a physiotherapist, facilitating independence is really key. So if she's independent in a way that she can do activities by herself, she can shower herself, she can groom herself, she can work. You know, like after stroke, people become so depressed, become so reserved, thinking it's the end. But if someone can go an extra mile of doing that, really, we're going far. And then, yeah, she's picking up. So 2 years, yeah, and we're still moving. And I know we shall get there.
That is very encouraging. Yeah. Well, at this particular point, I'd like us to take a very short commercial break for about like 2 minutes or so. Then when we do get back, we're still going to take you further into this topic of discussion, because I believe it is one that we all need to know.
This isn't just a girl. She is the future. This is a teacher, a doctor, a community leader, our future president.
This is our family's pride.
This is my friend.
This is the future of our nation. She is the future of Uganda, and the policies I enact today will protect her from teenage pregnancy.
She is the hope of our community, and I will talk to others about how we must protect her.
She is our family's pride, and I will protect her from child marriage and talk to her about the dangers of teenage pregnancy. We each have a role to play in empowering our teenage girls to protect them from child marriage and pregnancy, because when we empower them, we empower our nation. Protect the girl, save the nation.
Their support meant so much to me. I stayed focused and was protected from child marriage and teenage pregnancy. I will support other girls against child marriage and teenage pregnancy.
Take action. Report any case of defilement or child marriage to the police or call Sauti 116.
The Tales of Kasozi, brought to you by Uganda Communications Commission.
Hello?
Hello?
This is Kasozi. How can I help you?
Hey, Kasozi, my brother. Long time. We last met when we were at campus. It's been a while, but you are the person I'm looking for.
Campus? Really?
Hey, you don't remember me?
Okay, so how can I help you?
I'm stuck in Gulu making millions and I need to urgently send money to my sick mother. But I can't find any mobile money agent near me. I've sent the money to your phone, as you can see the message. It might take a few minutes to come through, but I urgently need you to send the money to my mother. Let me send you her number and you send it to her chap chap.
My friend, I'm afraid your mom is going to die.
What?
Because I don't know you, I never went to campus, and I'm also in Gulu. So can we meet at CPS, we talk about it?
Stay tuned for what Kasozi does next.
Tofera, refrain from unnecessary engagements with strangers over the phone. This message is powered by the Uganda Communications Commission.
Welcome back from that short commercial break, and you're still watching You Health Chat, proudly sponsored by National Medical Stores. And our topic of discussion tonight is emergency response for a stroke. It is one of the leading cause of death and, also a lot of disability. But probably there are sometimes, people might have their own notions, and maybe somebody gets a stroke with a seizure. That's also possible, and then they'll even think that, oh yeah, good day symbol, but in actual sense it's a stroke. But like I said, I have a young gentleman here who is actually constantly meeting people and helping to get people recover from conditions like that. And he's a physiotherapist, or a physical therapist as they might call them, and that is Titus with me here. Titus, you told me about that wonderful story that I feel encouraged. But now for you, what was your goal and what kept you going? You can imagine treating the same patient for 2 years.
Yeah.
What keeps you going? Because I believe, we're all human. Even some of the doctors sometimes might feel like, or if not so, try your luck elsewhere.
Yeah. What kept me going? Actually, I have to say she kept me going, herself. She's been patient. She accepted her condition. Yeah, she kept me going. I can't say it was me or something, it was her. Because someone like you're working with someone, they're also putting that effort. Trust me, you yourself are so moved, and you keep it on. All we need is people around us who are encouraging, and if they are able to push on with you, they're able to push on too. Yes.
Then is a stroke, majorly would it attack a specific age bracket? Because there are certain times where we think certain conditions are for the elderly. There is that notion and mentality.
Yeah. So stroke is actually there's research that shows that even a baby in the womb can get stroke.
Oh wow.
Yes. So stroke is happens to all people of all ages, from as early as someone in the womb to someone as late as their geriatric ages. But if you look at the so-called predisposing factors, it's mainly that people who are above 55 that are more prone to getting a stroke. Yes, that's the age that's really, really common with stroke.
Then is a stroke preventable?
Yeah, it is.
How?
So that's a range of things you need to do to prevent the stroke. So it comes out with lifestyle, it comes out with your diet, and but the basic things you need to do: exercising regularly, watching what you eat. Remember, like this is what people like, fast food. And then someone, like actually I saw something somewhere, someone saying like fast food was like someone covering that, the word fat with an S, but it's really fat. So every time you are eating food like that, it's not good for your health. So cholesterol levels build up, and then your arteries that transport the blood to different regions of the body become clogged with cholesterol and that fatty substance, and then in the long run causes because it brings up the stroke. So like watching what you eat is very important, having exercising regularly, and keeping a peace of mind. Actually, if you look at like the people who are more prone to getting stroke, men men like are faced with different problems like stress. The stress levels like in men are is higher, like on average. I know we are all stressed, but on average men are more stressed because they have this and that and this and that. And so yeah, you should avoid stress as much as you can, because if you look at stress as a component, stress is not only just that emotion and all that psychological being. Stress goes an extra mile of what called cortisol. It's a chemical like in it's a stress hormone. So every time you're stressed, it's like it's released in the body and triggers out some factors in like build up of sugar levels, because like it puts you in a mode whereby you want to going to engage into an activity that is really hard. That's how the body is like works. So you find someone when they are stressed, sugar levels go up, blood pressure shoots up. So you see someone having that likeliness of getting a stroke. Some men being stressed should be out. Okay, it's really hard to prevent it, but you should work as hard as you can to
minimize
the stress. So guy having regular visits with just for medical checkups, check your pressure, see how it is. Yeah, regularly, not only once, not only twice, but regularly. You don't need to go to get so bad to go to the hospital. Make sure you once in a while you go to the hospital just without any pain. Say like I want a medical checkup. Do that. It's like more. It's actually cheaper to go in there and then you check what's your problem, other than wait for the problem
conditions to get worse.
Yes, and then it is really devastating. Like if you can get to that point whereby you are sick and it's expensive. It's really expensive. And then yeah, so there are simple things you need to do, but and avoid certain things, certain drugs. You know, people like have smoking, alcohol, things like that. They just change your whole system. Your blood pressure shoots up, so they put you to more risk of having a stroke. Yeah, and then like family planning methods. Some people like opt to get these pills. Those things, they change someone's makeup, the hormone composition. It just changes. So someone like is more liable to getting a stroke. You should use more. There are better methods. You just have to talk to your partner, and then to your doctor, like, and see what is better for you, and see the side effects and the benefits. You weigh them, and you see if it is worth it. So there's so many things you can take, but basically that.
Then what are the chances that if somebody has had a stroke, and they possibly recover from it, that it will not reoccur again once they change their lifestyle?
Yes, the chances, I can't tell the chances, but what you should know is that there is a more risk for someone to get a stroke if you ever had it.
Okay.
It is always there. So you just need to take caution, be more cautious, and check your blood pressure. Watch what you eat. Just be more cautious, because there's more likeliness of you getting the stroke again. And then maybe like even family members, make sure like you talk to them about it, because if you have the stroke, there is it's a predisposing factor for them to be having the stroke, because it's like telling you that your family has this. It's a genetic makeup of someone. So like it gives them like a heads up, like take care.
So having had it before and it reoccurs, will it, assuming somebody had a pre-stroke, then and it reoccurs, will it still manifest in the same way, or this time having had it before, it will be now the major attack?
So just like we said, after getting a stroke, like the brain cells dying off, they don't recover. They just dead. So other cells take up the functions of those cells. So imagine like you having two keys, you've lost like one key, you have the spare key. So the spare key also gets lost. So the thing is like the condition is even worse.
Okay.
Yes, because you already have a scar on your brain, and then like you're getting another wound like on the brain. So the scar plus a scar is worse. Can't be easily, can't be less, or sorry, is worse.
Oh my God, oh my God, oh my God. What's the worst case scenario you have seen of a stroke?
Death. Nothing more.
Okay, at the point if somebody, I understand, at the point if somebody doesn't have to die, the level of paralysis.
Okay, so if you look at some extensive research, it is what we call cryptogenic stroke. Is some, okay, like there is cryptogenic, there is the brain, okay, it's like recent research, and then like brainstem stroke, like that one, whereby someone is just, like they can't do anything.
They're lying there?
Yes. They are like the whole, from the neck, they can't do anything with their neck. So that's the worst scenario I've heard of. I've not seen it, and I don't wish to see it because it's really devastating. Imagine you just there doing nothing.
You don't wish to see it?
I don't wish to see it because, like, really, I'm really moved when I see someone in pain. I want to get in and do something, but if someone is like in that condition, there's little to do.
Oh wow, okay. Now you said a person can also get one, or even a child, when the baby is in the womb, they can get a stroke.
Yes.
Because if it's got to do with lifestyle, how does the baby now get into that?
Actually, I have that's something I've not really like encountered. It's recent research, someone talking about it, that's very possible. I've not seen it, but it could be like from someone having, if you look at someone having, like the blood saturation is like in their, like from the mother and the baby is being interrupted, then like could be from a mother falling down or doing anything like trauma. So the blood supply is interrupted with to the brain. So could be even be sickness. So like leading to the problem, like be an infection, but basically like it's really rare, but it's possible. Being rare doesn't even out that it can be possible. So I've not seen it, but it's very possible for someone getting a stroke as early as that in the womb.
Now, just like in many of the other conditions, people have been able to test and know whether they can be able to get this condition, whether they can be able, you know, like let's just say like cancer per se for the women, for cervical cancer screening. You're able to tell whether you're safe and all that. Are there any form of tests that can be done for somebody to know that possibly at a certain stage in your life, or as you're getting older, or maybe because you have condition X, you're prone to having a stroke, and possibly maybe this soon, or a pre-stroke?
Okay, like tests would be simply as blood pressure monitoring. Yeah, that's one of the simple things you can look at. And then if you can, if you have problem with your cuffs, like your cuff, mainly this is where most cases the blood clots are built up. So there's no basic test like in terms of like this one is more important, but just simple things like being overweight, having a mini stroke. Those are the things that give you heads up that you are more liable to getting a stroke. And then your family history. If you go back and check your family and you see there is someone who got a stroke, there's more likelihood of you getting a stroke. But there's no test like this is for stroke only. No. It's a series of things you look at.
Then how do you normally people deal with it? Because you know, one thing that I think makes even the condition worse, or maybe even that people will even get to a point and give up on a person and let them pass on, is it's expensive to manage, deal and handle with the stroke. Right from the MRI that has to be done, which is very costly, then going into the whole process of physiotherapy. What is your take on that?
Yeah, so for sure it's really expensive. That's when I can't leave it out. It's really expensive. But yeah, you have to, you know, like there's nothing more expensive than life. If it is worth it, you need to go for it. So we start these we start these stages. Like someone, you know, after someone starts seeing a stroke, the way they present is different from the time as they're recovering. So first time they most likely to be flaccid. Like let me say, like one side of the limb is affected, like one side of the body is affected. They tend to be flaccid and they can't use the arm anywhere. So like that stage, we do basically exercises, positioning, and then with that, and as we are going on, we see someone get into what we call spastic mode. Like they tend to have their hands like the flexor component, like you see the arms more folded and then the leg more extended, what we call spasticity. So with that, you go on with stretches and using some braces and then incorporating many things. And then we have what we call hydrotherapy. Actually, is what we do it where I work from. We really do it, and it's really doing, can say, miracles.
What is the hydrotherapy now?
So hydrotherapy is basically exercises in water. So someone who's like really, people who are having stroke, their limbs are weak. So like if you get into water, let me say like a swimming pool, a good one. So you find that the water that you're in, it has what you call that buoyancy that gives you when you're in water. You are more supported. And so remember, moving in water is a little hard than moving in air. If I can move my hand like this, it's hard for me to move the hand there in water. So that buoyancy keeps you supported, like keeps you up in water, and then that viscosity in water brings in that resistance. So that one builds up your muscle strength. So the stronger you get, like the more the muscles become more functional. So with that, as we go on, see someone building up their strength, and then someone is able to do things they couldn't be doing. So it's really good, and I would like everyone to embrace it. Even someone who's dealing with weight loss, it's really good. Hydrotherapy, at some point.
Okay, then it's said that treatment is most effective if started right away. What is the right away? Because you said you work as a team, everybody to help a patient recover. Might take even a psychologist, might take everybody in whatever corner of their expertise to come in and reinforce on this one person. So at what stage should the physiotherapy come in?
Like I said, like the stage is right from the time someone sustains a stroke. Because after sustaining a stroke, someone is let me give you a scenario where someone is having left side hemiplegia, so they can't use this side, of course. So a physiotherapist will give better positioning, and so someone is prevent further injury. So like if you have this side very weak, you can't use it at all, and you are, let me say like you're on bed rest, and let me say like you're lying on this side, the day like the next day, like after a few hours, this part could end up with a dislocation. It is something really painful. Stroke, you should do everything in your power to make sure like do the prevention, because really it's really hard dealing with stroke. So like should be right from the time they sustain the stroke to the time they recover. Actually, some people fully recover, luckily. Other people, they may not recover 100%. Okay, most people don't recover 100%, so they remain with disability. But we always aim at facilitating independence. So if they're independent, we have done something really good for them. But the stage doesn't matter. It should be from the very first time to the time like they're fully recovered.
Are there any specific diets such a client is supposed to take? Or they stay with their normal meals? Because like if they feel, if the side is already like, if you have undergone half paralysis, are there specific foods you'd say maybe like that they're supposed to take, like to need the energy, to need this, I don't know.
Anyway, that for the foods, like I would like to maybe like reserve that for the nutritionists, but I would still give some encouragement, because if you look at someone who's having stroke, they tend to develop arthritis. Imagine like you having one side of the body not working well, and then you're using one side of the body. You tend to overuse one side. And so God created us with two lower limbs. So you yourself, you're walking, but you're more one side. So like you end up with having more, like end up with arthritis, because your weight is a lot on one
balanced
side.
on one side.
And then you find, I would encourage someone to have fish, having some mukene. I know some people don't like mukene, but it's good for that calcium. So remember, as the body is recovering, it needs the nutrients to build up. So in building up, it will require those nutrients to bring in to that children to build it up again. So as we're doing the exercises, it's good for the body to have those nutrients such that the recovery is ongoing. And then also remember, like in stroke, someone is immobile. They're not moving as they should, so they tend to put on weight. So I would encourage someone to not eat as like something so
large
big.
portions.
Large portions. So I would like encourage them to watch what they eat. Yeah. So it is a lot, but just like I said, it's a multidisciplinary team. Also need nutritionist in that team to help us with food, because like specialty differs. So if I can deal with the movement and the pain, he can come in and do it even better than I do. So it's a big team.
It's a big team that is required in a situation
That's
like that.
why I say it's expensive, really. If you can prevent a stroke, do it. For sure, it's really expensive.
Now we've talked about, I'm looking at it in a sense of a person who possibly could even be able to afford or has a support system that can afford. Now what about the lay person down there in the village? And to them, they will run quickly maybe in their lusuku for the herbals to be able to see how to manage the condition. What's your take on that?
Anyway, my take on herbal, really, I don't want to say something controversial, but herbal, I'll reserve it to people who know it better. I don't have any knowledge about herbal, but I would encourage someone to do something which has research established in it. So if I see someone like having a stroke, like in that type of community whereby they can't easily access the treatment, with like there are better options. Like in Mulago, there's free treatment there. I would encourage them to go there. And then like physiotherapists, like are teachers. Actually, they're teachers, so they should teach the caretakers what to do, and then the caretaker like can carry on the treatment even at home. Actually, that's something we do because it's really a necessary thing. The time we spend with the client is less than the time the caretaker spends with the client.
True.
So if we can teach the client as much as she or he could do, is the best. So it may sound expensive, but it's better to do the right thing, though it is use as less as you can, and then like maybe like 1 or 2 sessions you learn what to do, you can do it at home, and then you can have once in a while visits to see your progress or to change the program, because as someone is recovering, they require different needs, and then we can still put them there as they're recovering.
Oh, that's a good one. It's rare that you'll find somebody open up and really say that once you take them through the sessions, they can also keep on doing some of the things on their own. Normally it is like, keep coming. Keep coming in, keep coming in. Because I am the expert, keep coming in.
Yeah, sure.
Okay, that's interesting. Now, you said you use clot busting medicines, there is surgery, there is therapy to reduce and control the brain, swelling. What other methods?
So methods, like it depends on the methods you're talking about.
The nerves, do the nerves also get affected in the process?
They do.
Take us a bit into the nervous system.
Because if you look at the nervous system, like remember there's something they say that what you don't use, you lose. So every time like your hand is not in use, what's called atrophy is what we call, like the stiffness kicks in, so the pain also has to come in. So imagine like if you have ever tried it out and held something as small as a glass of water, or like your phone, like talking on phone for about an hour. After that you come back, you feel the pain is in there. So like nerves, after like that period when someone's having stroke, the nerves like they're not working as they should, so they respond with what we call pain. So it is always pain, and then they lose function. If you're not using them, of course they lose function. So like the nerves, like if you look, they become numb. They're not working, they become numb. So is that it becomes like the atrophy is in there, the nerves like they keep on diminishing in function. Yeah, like the end, can't tell, but it's always the way like diminishing, going down, down and down. Yeah.
Oh wow. Okay, now it's just like a minute to the top of the hour. I would like you to share with me your winding up remarks. Share remarks with the person who's watching you right now on the subject matter.
Okay, so to our dear viewers, like I would like to encourage you to take care of your health, because no one is coming. Yeah, so you may think it is, you know, some people have something called YOLO, you only live once, but there is more to life than that. And take care of yourself. You may think it's expensive to do the medical checkups, but it's more expensive to, in the long run, if you sustain the problem, than you having it like dealt with as early as it should. Your lifestyle, have your lifestyle like in place. Don't do things recklessly, because it's your life, you have one, and make it count. That's all I have for you today.
Okay, thank you so much, Titus, for your time.
It's been a pleasure.
Now, for the person who's watching right now, I know the question is like, can somebody cure? Can somebody really get well? Recovery time varies from individual to individual. It can take weeks, it can take months, it can take years. So, based on what Titus has been telling us, please let's live a healthy lifestyle, and also let's be in a position to run very fast and seek medical advice as soon as you see some of the signs or symptoms that were mentioned earlier, like, you know, numbness, when somebody's sloppy, and we're able to get to know why this is happening. Other remedies and options might be there, but the sooner you get to a health center, because this is a medical emergency. Well, that is all we had time for. I'd like to say good night from me and Titus. Keep watching UBC TV for at 10 o'clock. Rod and Gonzi will be coming your way with the 10 o'clock bulletin. Good night.